Salber with Health Innovation TV, broadcasting from MedCity Engage. And I'm here today with Geeta Nayyar, who is the Chief Medical Innovation Officer for AT&T. And Geeta, I have so many questions that I want to ask you, and I can't even think which way I want to start. But I think I'll start by asking you, so tell me what a Chief Medical Innovation Officer does.
Sure. So Pat, my role is as the Chief Medical Information Officer, although we do innovate a lot.
Oh, sorry about that.
That's okay. Basically, the role of the CMIO at AT&T is very similar to the ones that you see at hospital systems and the customers that we work with, payers, et cetera. So it's really a physician or a clinician that's able to bridge both the clinical side of healthcare as well as the IT side. So often there's a disconnect between what the doctors want, the patients want, and what IT either understands or can do, or vice versa. And so that person really serves to kind of make that bridge happen.
And I see that you have both an MD and an MBA, but did you also get formal training in health IT? How did you learn this stuff?
Sure. No, I did not. I think that for me the journey was always medicine. So I definitely did not go to medical school saying, I want to be the CMIO of AT&T. That was not how the story went.
But AT&T wasn't a healthcare company.
That's true. That's true. But basically, I'm someone who loves science. I love biology, chemistry, and I love people. I'm very much a social kind of people person. And so was always drawn to clinical medicine, come from a family of physicians. And as I was going through my journey in medicine and my training, I realized that there were so many inefficiencies in the healthcare system in so many ways that I felt like things outside the hospital really affected the way the hospital was run. And when I would talk to administrators or policymakers or the legal folks, it was really clear to me that they just didn't get kind of how the healthcare front lines worked. And so I thought, well, if I do an MBA, if I can speak their language and speak the medical language, wouldn't that make a lot of sense? And on that journey, basically the hospital system that I was at, George Washington, was going through our electronic
here in
medical
DC.
record. Yes. We were going through our EMR implementation, and I was very drawn to the project. I was, this light went off in my head, and I was like, wow, this could really improve efficiencies, improve the experience.
And all the things you wanted to do.
Exactly. If it just worked the way a doctor wanted to work, and if it just worked the way that patients needed it to work. And really my journey to health IT began like that. It was not premeditated, and here I am, and AT&T's been terrific. I'm a strong believer in mobile health and telehealth technologies, and really believe that the patient being at the center is where all of this is going to happen. And so I'm excited with what we're doing and where the industry is going.
So that brings me to the other question that I wanted to ask you, which is, it used to be I'd go to medical conferences and the sponsors would be health plans or drug companies or, I don't know, every once in a while, hospital system. Now I go to conferences and the sponsors are telecom. So tell us a little bit about AT&T and why it's now getting so heavily into healthcare.
Sure. So, I think the opportunity is really there for people to figure this space out, right? From whatever industry you come from. If we're looking at banking, if we look at the airline industry, there's so many industries that have done and gone through what healthcare is trying to do. And sometimes I think having that perspective from the outside in can be very valuable. Certainly AT&T's strengths are in mobility, in security, in really bringing the consumer to whatever space, or whatever industry is there. And so for us, we've invested in mobile health technologies, telehealth technologies, and really solutions that bring the patient closer to their physician, whether it's about access and getting a patient from a rural area to get access to a physician through video monitoring through a telehealth solution or through remote patient monitoring and being able to transmit their diabetes information back to their doc or their blood pressure medications back to their doc. We really believe that it's not about just taking care of patients within the four walls of the hospital, but actually moving those walls away and meeting the patient where they experience disease, right? Whether in their home, their community, or their place of work. And it's really this idea that healthcare can be in the palm of your hand.
Any place, any time, right?
You got it.
And so I just want to drill down into that a little bit because you said AT&T is investing in this space. So what do you mean by that? You're buying companies, you're helping companies to become more successful but not buying them? What's the end game here? I've heard, if you don't mind me mentioning a competitor, that Verizon is kind of, linking lots of different apps together. And Qualcomm is obviously doing the same thing. Is that what you're up to at AT&T?
Sure, so what we're focused on, so these are solutions that we offer in the market today. So we have a remote patient monitoring solution, we have a telehealth solution, we have a mobile health solution. So when I say we're investing in them, I mean to say, one, that we have products and solutions available today, and we continue to look into that space and see where growth opportunities are, where the right partners are for us to go.
And who are your customers for these?
Our customers are payers, providers, certainly patients to the extent that they're part of the ecosystem. But yeah, we have Baylor Health System, we have Henry Ford, we have a number of customers today that are using our solutions.
And I think it's appropriate for us to finish up here today, since we are at a conference on patient engagement, and you're a speaker here today, to understand a little bit about how you, as an individual, as a chief medical information officer, and affiliated with AT&T. So how are you looking at and thinking about patient engagement?
Sure. So again, I think when you think about patient engagement, right, it's a catchphrase, but as a physician, when I think about an engaged patient, it's someone who, when I'm in the office with them, they don't just look at me blankly when I give them a diagnosis or I give them a medication.
Are you still practicing?
I am. I'm a rheumatologist by training, and I still do practice. AT&T's been very supportive of that, and I enjoy it very much, and think it really makes me able to do what I do every day with AT&T. But basically, engaged patients are ones that know about their disease state, know about their medication side effects, and know where to access tools that can help them, whether it's physical therapy, whether it's a support group, whether it's a friend down the street who also has the disease. I think an engaged patient can mean a lot of things. And so if you think about the tools that are out there to help an engaged patient, it can be a simple printout or a handout, or it can be a mobile health application, or a remote patient monitoring solution, or a telehealth solution. But there's not, earlier someone asked me the same question, and they said, so how do you get patients to engage with mobile health? And I said, that's not really the question. That's not the question I ask myself, right, when a patient comes in. It's, how do I get a patient engaged in their diabetes, engaged in their lupus, their rheumatoid arthritis? And so I think patient engagement is that. It's how do we get patients to actually care about their health care, understand it, and make it kind of fun. Make it kind of fun to be healthy and fit, and share, whether you ran a mile or two with your friends or your neighbors, or say, gosh, I just don't feel like running, somebody come get me to get off the couch and do this. And so for us, I think patient engagement means all those things, and just finding the right places to help patients do that better.
And I'm tempted to ask you, how do you make lupus fun? But I think I'll leave that for another time.
And I have a couple of answers for that.
Go ahead.
I think the biggest thing whenever patients have rare diseases like lupus is to make them feel like they're part of a community, right? We all like to be part of a community. We're all here today. We like to be part of the healthcare industry or the health IT industry. So
how do you as a physician do that? How do you help me as a lupus patient connect?
So, again, I think finding that community, letting them know that they're not alone, even if it is a rare disease. There are absolutely people like, that person that have this issue and deal with the same issues. So whether it's finding a support group, whether it's finding a social media outlet, whether it's just helping them understand their disease and realize it's very manageable. It's not something that's a death sentence or a stigma that they have to be afraid of. I think it's about empowering people and making them feel like they can control their health, because ultimately that's what's so debilitating about having a health issue, right? Is this feeling of vulnerability and this feeling that I can't control what my body's doing. Not saying that we can. I mean, certainly, medicine is not a, that's just one of the things we deal with in medicine. But I think to the extent that you can help someone take care of themselves both mentally and physically, you will find much better outcomes overall. And so recognizing that having a community and being an engaged member of that community will make you that much stronger. I think it's important.
Okay, that's really great. And so I'm assuming that either you or someone on your staff would help someone like me if I didn't know how to go about reaching out and finding a community.
Oh, it's part of my office visit. When someone's first diagnosed, I ask them myself personally. I don't outsource that to anyone. I think it's an important conversation.
You prescribe some social media.
Well, I do. I give them, sites and associations that I think are credible, whether it's the Arthritis Foundation, the American College of Rheumatology, the Lupus Foundation. And look, there are games out there. There are ways to have fun. There are, walkathons and marathons and just places you can go and meet people that, just like you would say, if you're a young professional, you want to meet other young professionals, or, you like to play tennis and you want to find a group that plays tennis. So you have lupus. You want to meet some people who have lupus and you want to know how they manage their life, their work, their family. I'm all for that. I think it's just as important as giving them methotrexate or Plaquenil or any of the other medications we give.
Okay, so it's not only that patient engagement is the blockbuster drug, but social media might be a part of it.
It's about being social. So whether you're in media, whether you're not in media, it's we're social creatures. I think medicine is a social science, and you have to realize that it's not just an individual all the time that you're treating.
Okay, so I think this has really been terrific because for me as a physician who trained in a different time and viewed the world quite differently for most of the time that I was in practice, I find it really encouraging to see that there are physicians like you who are embracing the new technologies, embracing these new ways of doing things, and bringing social media and mobile apps and the power of AT&T into the physician-patient relationship. So any last words to you before we say goodbye?
No, just thank you so much for being here. Thank you for the work that you all do, and I'm glad that this is the highlight of today's focus.
Okay, great. Well, so this is Pat Salber with Health Innovation TV, broadcasting at the Engage conference put on by MedCity News here in Washington, D.C. Thank you.